my honor today to be here. In the 5 years plus I've been the director of the Narcotics Bureau, and as I've crisscrossed the state speaking to all sorts of groups, I've never done this before, but I'm going to do it this time. Usually in government, we try to work so hard to make things happen, and sometimes it's very difficult to do. But as part of the committee that started to organize this particular meeting, I was approached last year in Tulsa by Dr. Sandbar, who had a vision of trying to get this group of people together. And as we go through my slides and my PowerPoint very quickly today, you'll understand the passion and why I believe it's so important for our state and for the safety of Oklahomans for you to be in this room. So I would very much like to say thank you, Dr. Sandbar, and just give him a hand clap. It's amazing the schedules and the people that he co-opted the resources to do this, and among other people, but it's really amazing how this turned out because it's very timely, and as we go through the slides today, it's very timely why we need to be here. I have two people with me. I want to introduce my Chief of Diversion, Melton Edmonstein's in the back of the room. Melton's here. Also Jeff Slotnick. Jeff Stan. Jeff is my Chief Information Officer for law enforcement and really is the real brains and the day-to-day operations of our prescription monitoring program. So I wanted to introduce those folks, and by all means, if between us three, if we cannot answer your question, we may be in trouble. You may have stumped us. So we've brought our resources out today to try to answer your questions. I know time is of value to everyone in the room, and we're going to try to stay on course. This is a presentation that I really put a lot of time and effort and energy into the thoughts of these slides. I constantly, as the Chief Drug Enforcement Officer for our state, I constantly had this dilemma about the intrusion of government and what we're doing when it comes to narcotics. Some of the things that we deal with are very easy that we have almost constant agreement on. Nobody in this room wants a Sinaloa cartel member across the street from you. Nobody in this room wants to be at a local hotel and have a methamphetamine lab next to you. We can almost all agree with that. But almost going on 25 years ago, as I listened over a body wire, my first drug transaction in Stevens County, out in Marlow, Oklahoma, is anybody from that area, I listened to my first drug deal, and that's going on 25 years ago. And it's amazing what keeps me awake now versus 25 years ago. Because things have gotten so much more complex, not only for me, obviously as a director, but really for the things the things we're faced with in our state. Things like prescription drugs, things like the controls of pseudoephedrine, and this intrusion of government. And there's hardly a day, I should say, for sure a week, that I do not have to think about and ponder my staff and myself about how are we going to intrude upon the good citizens of our state and find a balance between public safety and the intrusion of government. This is an important slide. They're all important. No Oklahoman, this is critical, no Oklahoman should be in pain. We are not in the business at the Narcotics Bureau to dictate to our medical professionals what they need to do in their practice. So it's very, very critical that no Oklahoman should be in pain. I believe it's a four-pronged approach to some of the issues. We have these elements. We have a health care issue. We have a commerce issue. Some people don't like to talk about that, but it's a commerce. We have a public safety, and of course, it's registration or administration that we deal with at the Bureau of Narcotics. Less than 1% of our 17,000 registrants in the state of Oklahoma ever have, way less than 1%, ever have any type of adverse relationship or any encounter with the Bureau of Narcotics. Many times you think that, well, there's just waiting in the shadows. These gun toters are waiting in the shadows for me to do something wrong. That's just simply not true. Way less than 1% have any type of issues with the Bureau of Narcotics. One of the first acts that I did as the director of the Narcotics Bureau now, over 5 years ago, one of the very first acts, and some in this room were there, was I brought all the medical boards, investigators, these folks, associations together, and really kind of just spoke what I felt like that our role was. And it's very much the same role today. It's a cooperative role with our boards, with our association, as a registrant and a holder of registrants, but it's really a very cooperative. One of the greatest pleasures and one of the greatest pride I have as far as an award was that honorary doctorate of pharmacy. That was given to me, and when they gave it to me, I was shocked. But they gave it to me because of the cooperation the Bureau of Narcotics has with the Pharmacy Board. And that's a value to me as a public servant. That's a value to me to know that we are working very hard. But I always say this, there comes a point in time where the why in the road happens. There comes a time where public safety is the most important thing, and we have to, at that point, we have to take action. Sean Sutton is a great example of that. Sean and I speak around the state together. He has become a close friend. But that's an example of just an intervention trying to get someone, because, by the way, this is no respecter of persons. And now, at that point, whenever public safety became an issue one day, and we probably, and he will admit this, probably saved Sean's life. These are startling statistics. By statute, under Title 63, all drug overdose deaths are reported to me at my office. This should alarm everyone. This really is an upshot of our problem. Since 2001, we've had a 108% increase in drug overdose deaths. Last year we had 750, or the year before 715. 2011, because they're obviously ME reports and they come in late, so it takes several months to get the real count of last year. But I can almost guarantee it's going to be higher than 715. 108% increase. A lot of people will think to yourself, the general public, whenever I speak, they think to themselves, well, it's got to be methamphetamine. It has to be heroin. It has to be crack cocaine. But that's simply not the truth, and we all know that. Last year, the CDC came out, and they told us what we already knew at the Bureau and what many in this room know, that Oklahoma ranks #1, and we're not talking about the BCS rankings. They rank #1 in painkiller abuse. We knew that. And also 9th in overdose deaths. It's time, really and truly. I was quoted a couple years ago when this all started. I said one day to a newspaper reporter, I said, we've got a silent cancer in Oklahoma. And that's so true. It's silently killing Oklahomans. What percentage of those drug overdose deaths? Look at this. 81% prescription drugs. Only 19% of methamphetamine, heroin, and what we consider the illegal drugs in Oklahoma. So this is alarming. Not to go, we all know what basically is most abused or the overdose deaths. Methadone, great story on methadone. A few years ago, we were seeing just a rapid increase in deaths. We brought a lot of folks together to try to look at this. We all know about the half-life and the things about methadone, and we were just seeing this incredible increase. You know, there's some hypothesis out there. I had an opinion, well, is it methadone clinics? What's going on? So we brought professionals, the medical community together, and along with Lyle and many of our boards and associations, and really started to make an awareness of how dangerous it is. And really we've seen methadone deaths drop after that. And there's really a law out there. Representative Tibbs out of Tulsa passed a bill, and it was signed by the governor. It said that you shall, that's the only shall when it comes right now with the prescription monitoring program, that if you prescribe methadone, you shall review the patient profile of methadone. Again, a lot of the same things that we look just in a different charts. Non-fatal, a couple of years ago, it really troubled me. Obviously, I do not look at all 700 overdose deaths, but when the public calls me, if there's one that is alarming, I do look at those. And I remember someone at my church, they came to me and they said, you know what, there was a death in South Oklahoma City, the Moore area, and they came to me and they said, we'd really like for you to look at this. So I I got the autopsy report, and they're never pleasant, right? I mean, they're just never pleasant because really the way they're written, it's this person and what they were doing, it's really alive, and it really just really gets to you. And this 18-year-old young man, and this several years ago, and as I read this autopsy report, you know, I just thought to myself, just think about, because in drug enforcement, we always try to be proactive, not reactive. If you're reactive, because it's an in-progress crime, you'll always be behind. You know, it's an in-progress in a sense. We're doing undercover deals. We're listening to people's phone calls. It's a very in-progress crime. It's different than other law enforcement. But you have to be proactive. So I'm sitting reading this autopsy report of this 18-year-old young man who's now deceased and will never breathe again on this earth. And I thought to myself how crazy that is to after the fact. So what we did, we with our legislators, and there's actually a bill out there now, or has been passed, that we monitor the non-fatal in all the medical emergency rooms around the state. So now we're getting a grip on, and my whole strategy on that was that, say there's a problem with heroin or a drug in Woodward, Oklahoma. Well, before we have 5 or 6 bodies to account for, we could be proactive and try to do something about it. So we are monitoring this now. What type of drugs, non-fatal, are happening in our state. This is a neat slide. It has nothing to do with prescription drugs. It has everything to do with methamphetamine. This is so simple that anybody can interpret this. But what this means to me, the first time I saw this, is really on the pinkish graph or bar is methamphetamine labs, and in the blue is meth deaths. And that's really a pretty good correlation. And what that tells us is, obviously, when there's more drugs out on the street, there's going to be more deaths. And that's so true. This is a yellow lab, a black lab, chocolate lab, and there you got a meth lab. My longtime friend, Rob Hudson, the former district attorney up in Payne County and now the first assistant attorney general, he was really proposed a question, and I'm not going to get off on pseudoephedrine regulation here, but a few years ago I was opposed because, again, the infiltration of government when it comes to making pseudoephedrine a higher schedule than Schedule 5, until I read the Oregon study. The Oregon study 6 years ago passed it as a Schedule 3. And by the way, I'm not supportive of Schedule 2. I don't think that a person needs to go to the doctor every time for a Schedule 2 for pseudoephedrine tablet. But I am supporting the 3. The reason is because the comprehensive positive results from Oregon. It's just not about law enforcement. You read that study, Oregon crime rates at a 50-year low. The request for mental health and substance abuse treatment is down 32%. The whole system in Oregon has changed because of that passing of that bill. And personally, we talked to the district attorney that passed that or got it passed out there in Oregon. They haven't had, at that point, this was a month or so ago, they had not had one doctor shopper. I'm of the opinion these people are not going to bombard our doctor's offices. I was flown at Kentucky's expense 3 weeks ago to testify, myself and the Bureau of Narcotics director out of Mississippi, who passed the same law last year, and it's amazing what's happened. It has had a collateral positive effect on their whole state. So it's something that we have to ponder, but there again, it goes back. That's not listening to a drug deal in the parking lot in Marlow, Oklahoma. What that is intrusion of government. Do we want a balance? And we all have to ponder that. Do we want that an intrusion with results, or do we not? That's what we all have to decide. That's what the policymakers have to decide. But the meth lab is not the dog you want, by the way. This is a strategy that really I adopted in 2006. And it was so simple to me, but really this is how we're going to be successful in Oklahoma. It's really this PIE strategy. Prevention through education. And by the way, the long-term success of Oklahoma will always be education. It will be changing a generation of people. Now, you have to remember, when I left public accounting and into drug enforcement, I had one thought in mind. I got in this job for one reason, and that was to arrest as many bad guys as I could. But don't kid yourself. We need the supply side stopped. But to change a life, a 4th or 5th grade student in our communities to say, I'm not going to do what my folks did or my uncle, I'm going to stay away from it. That's a long-term success. So we have to have our prevention through education. And then this intervention. When I first showed this to the hardcore narcotics agents at the Bureau of Narcotics, they thought I'd lost my mind. But the intervention is what we want you to do. We will never arrest our way out of our prescription drug problems. We believe at the Bureau of Narcotics, we believe there's 100,000 plus Oklahomans that are having problems. I believe this crowd right here, we've got people in here having problems. Almost everyone in here probably knows somebody in your family that's having problems. So what we have to do is unmask this thought that it's just going to go away by itself. It's simply not going to. So the intervention in this is really you. It's our medical professionals that look out there, use the prescription monitoring program, and say, you know what, we need to look at this. Why are you going to 4 or 5 or 6 doctors and I didn't know about it? You know how many, we arrested the #1 doctor shopper, what we call doctor shopper. They were going to doctors of dentistry. They were going to everywhere. One person. You know how many people in 1 year this person was going to? 195. You know how many pharmacies? 105. So no Oklahoman should be in pain, but folks, that's not about pain. That's about addiction, and it's also about economic gain. So there's those glaring examples. But don't kid yourself. The Bureau of Narcotics is in the shadows. When the criminal justice system gets involved, and trust me, I'm a quarter of a century into this, and it's my calling. But when we get involved and corrections get involved and your prosecutors get involved, guess what? You better get your pocketbook out. But the intervention with our drug issues, especially with the prescriptions, really, I can't say enough. It falls on you folks using this system and figuring out ways. This is we believe about 70% of our medical professionals are using the prescription monitoring program. I'm not going to be happy personally until that's 100%. The goals of the PMP: reduce substance abuse, reduce doctor shopping, reduce prescription fraud, reduce other illegal activity related to pharmaceutical drug diversion, provide an additional evaluation tool for medical professionals. Important dates. We are the only state in the nation that is real-time prescription monitoring program. And I know there was a question in the hallway. Some of the pharmacies are just now getting up, but we are within 5 minutes. The dispenser should be in the system. So we're the only state in the nation. We're very proud of that. Very proud of that. The only state in the nation that has that. Other dates, meth registry, we won't go over that. 24 hours. For a while, the prescription monitoring program, some will remember when it was like a 30-day dump. It did, it just did very little good. I mean, it did, but it didn't. But now it's almost real time. It's just a matter of time. This is interesting. I always show this slide because it just has significance. At one time, we started blocking pseudoephedrine. We started, remember when the law passed, we started blocking it. We had at a snapshot in time, we had 4,500 blocks. I asked my analysts, I asked them 2 questions. One is, how many of these people that were blocking have criminal convictions, and how many of them have drug convictions? It was alarming. It was alarming how many we were blocking. And see, you just don't hear about that thing. You just don't hear that are these type of policy changes really doing any good? I submit to you at times they do. All kinds of problems with prescriptions. These are armed robberies, employee theft, lost in transit, all kinds of different things. This is a program that Chief Edmonstein and some of his group, they came to me last year. They came to me and said, and not to get on the economics of the drug trade, because I really like to talk about the economics of the drug trade. It's an amazing economic model when you look at it, whether it be illegal drugs or really prescription drugs. And when you look at the economic model, you always have to look at it from a supply and demand model. That's the way it is. It's just supply and demand. Now think about it, the supply side, especially when it comes to like a methamphetamine lab. You could go in Walmart or anywhere and buy a methamphetamine lab for $22, $23. And the return on your investment on that is incredible. So the supply side and the pricing model on the supply side of drugs are something that you can't even imagine, the return on your investment. Think about the demand side. It's not like you go buy a vehicle or you go buy new furniture every once in a while. The demand side of the economic model is incredible. It's addicted driven, so you want it constantly. So that's why people wonder why can't we just all of a sudden solve these problems? Because look at the economic model, and it's just amazing. So on the supply side, we believe there's a couple of issues. One is that we have to make sure we slow down or stop the doctor shoppers. We have the intervention of the medical profession to try to look at these profiles of these patients to make sure that it's all on the up and up. But also, we have unused prescriptions in our cabinets. Nobody in Oklahoma seems to want to throw anything away. So at one time, we would do these take-back programs, right? We would go into a community, and everybody would come, they'd dump all their pills, and we'd all... But guess what? It was so inconsistent. So the idea was that we would take these mailbox-looking containers, and we would put them in secure locations around our state. We would put them in police departments and sheriff's offices. We would have an MOU. It would be a turnkey operation where we wouldn't burden our local law enforcement partners. And you know, when we thought about that, yes, it's a consistent place that people can dispose of them. So that's what we did. We bought these. As to date, I think we have 115 out. 115 of these boxes around our state. We have, to date, we've had 6,000 pounds of unwanted drugs that have taken out of our cabinets. It's amazing, some of these, how old they are. I told somebody there's a lot better drugs out there than there was in 1950, I'm sure. And what the beauty of it is, someone came to me and they said, you know what, there's an organization called Covanta Energy up in Tulsa, and they take waste material and they convert it into clean energy, and they're running a refinery out of Tulsa. When you hear stuff like that, I'm an old narcotics agent. I said, I'm just all hinked up. I don't think that could be true. So we went up there, and guess what? It was true. So at zero expense to the taxpayers of the state of Oklahoma, we take these unused, unwanted, dangerous, life-threatening drugs, prescription drugs, out of the cabinets of Oklahomans. We take them up there, we dispose of them, and turn it into clean energy. I just don't know if you could have a better deal than that. As an old bean counter, as an old accountant, I wanted to somehow measure what we were taking. It's impossible for relatively a small agency to count every one of those pills we take, because we have sacks of them. You can imagine, 3 tons. So what we decided was that we would weigh them. So we know what container they came from. We weigh them, and now we do a spot audit. And we audit and see what's in there, and we're going to see the same things. Everybody in here knows what we're basically getting. But we will never know, and this is what, when we go around, we put these boxes in, and we talk to our local departments, and we talk to press, we will never know the impact and the lives that are saved because we've got those pills out of there. So if someone in your practice and in your influence asks, what if I don't use all 30 pills or all 60 pills? Remind them. You can go on our website, and these boxes are all over. There's 114, 115 of them around the state. And guess what? They stay out of our water supply. It's just a win-win. Here's where they're at. They're everywhere. They're everywhere. We've got every county covered now, right, Melton? I know LaFleur County, and we're going next Friday over at Podo. We're going Friday to do one. So we've got others asking for them. I know there's a waiting list. Here are the things in Title 63 that basically everyone in here should know. These are the things that if you have an issue with the Bureau of Narcotics, it's going to be one of these issues. It's going to be one of these issues. A lot of times we've been very proactive about like change of reminding registrants. At one time we would just basically fine you, or now we've got a program that they call the registrants. They try to notify people. It's not about. I'm a firm believer that in order, Vince Lombardi once said, you know, people that work together will win, whether it be against complex football defenses or against the social ills of society. And I believe that. I believe that working together and as a partner is a lot more important than us going and finding somebody because they're a little bit late on their registration. You know, we always will have those type of issues, but we're trying to be, with relatively a small staff, trying to be proactive with our registrants. But this is the things you really need to know about.